Hi guys, I wanted to give you your feedback for this latest case study on the amputation patient. First of all, really good job. This case took a lot of different concepts that we've talked about throughout this course and pulled it all together into one patient. This is a really good example of how someone who has diabetes ended up with an amputation. It's very rarely one or two comorbidities. It's often a handful that have all played together and kind of interacted to make these issues an even bigger deal. So I just want to give some feedback on some of the things that tripped people up. In the first question, it was talking about what diagnoses in the patient history would have suggested low tolerance. I think every single one of you hit COPD and congestive heart failure, absolutely. The trickier ones in there were also hypothyroidism, which can definitely cause decreased activity tolerance, as well as depression. Just being aware that depression, even as a mental illness, certainly can cause low activity tolerance. It can cause people to feel more fatigued. Let's see, nocturia. You all were spot on about what that was and that it affects with sleep patterns, and everyone mentioned that it would contribute to fatigue and possibly activity tolerance as well. I also really wanted to see the safety component though. If this patient has a new amputation and she's getting up multiple times a night to use the bathroom, we're going to have to consider her risk for falling. Let's see. Some really good responses to whether or not we use MET levels for indication of oxygen consumption. You all said no, and I agree with you. These are meant for healthy adults with average amounts taken compared to the VO2 max. Considering that she has COPD and congestive heart failure, she already is probably at a higher MET level with even just low level activities, so these would not be a good way to measure her oxygen consumption. So most of you said that perceived exertion, the Borg CR10, measuring dyspnea, those kinds of scales would be a better measure, and that's spot on. So good job with that. Okay, so how would you expect this patient's heart rate and blood pressure to respond?
A lot of you answered this question based on the things that we talked about in lab this weekend. However, recognize that someone with congestive heart failure is actually going to have different responses than the typical cardiac or normal functioning person. So with congestive heart failure, heart rate sometimes is blunted even if they are not on a beta blocker. It just does not increase linearly with exercise. So particularly with a beta blocker, but also a lot of times just with the diagnosis of heart failure itself. And with blood pressure, vasodilation does not occur as easily in patients with congestive heart failure, and that's really what increases blood pressure, increase that systolic pressure, is that vasodilation and increased pressure of the artery. So oftentimes you won't see a significant increase in blood pressure above baseline. So if that does not make sense to you, if that's not ringing a bell, go back and review Cameron, table 25-6, and kind of the paragraph surrounding that. It talks more about exercise response in patients with and without heart failure and how those compare. Some of you nailed it right on the head. Good job. If that was not fresh in your mind, just go back and review that before the final this week. You all were great on how to monitor during a physical therapy exercise, so I was happy to see that. Good on positioning with the contracture. Most of you did a great job as far as what instructions you would provide in the care of both the left lower extremity that's remaining and the residual limb. So I wanted to see skin care for both, inspection for both, and then things for the remaining limb like smoking cessation, hot baths, using a heating pad, placing the feet by anything warm, wearing garters, walking barefoot. I mean, any of those things that were listed in your text, didn't have to have all of those, but I wanted to see some sort of education for this patient, how to care for that foot, because we're trying to prevent further injury, infection, and leading to an amputation in the same way it did for the right foot. So again, Melcy did really good on that too. And I like to see the comments about keeping the skin moisturized, caring for toenails, that type of thing. Let's see. And then how does diabetes impact her plan of care? There were a lot of varying answers. A lot of you talked about infection, wound healing, managing glucose levels, and ultimately that is trying to prevent further amputation. So there were some variations of those answers, but I wanted to see something about trying to avoid any further amputation because that's kind of our number one goal with patients with an amputation. You did a good job on the pulmonary exercises, donning and doffing the prosthesis. Most of you got this, but just remember the signs and symptoms you're looking for to ensure the patient's remaining stable. All of those vital signs that you listed and we've talked about are great, but weight gain is what I really needed to see there. And if I did not see that you were monitoring weight, I took a point off for that because that really shows. Some of you said edema measurement, that's true, but weight gain is really the fastest way to check for that. And then, like we talked about in lab, girth measurement, pitting edema, all those things just to measure and track over time. And then some great ideas on home modifications like sufficient lighting, clearing the walkways, getting rid of rugs, rearranging kitchen cabinets to have things down lower, a chair bench in the shower, just basically tripping hazards are the biggest one, in addition to the commode and the ramp outside. So then the last question, Synthroid. Synthroid's taken for hypothyroidism. So thyroid hormone is necessary for physical energy. It's necessary for hormone function. Another one of the side effects of hypothyroidism is dry skin. So some of you also recognized that staying on the Synthroid is going to help prevent the dry skin, which should help with wound healing as well. So you did a great job in kind of jumping into that and finding out how or why staying on her Synthroid is so important. A few of you also mentioned that this person's just at a risk in general because of all of her comorbidities, and that people who have a list of 7 to 8 comorbidities like this are much more likely, unfortunately, for morbidity and mortality after amputation. So overall, fantastic job on this assignment. I was really impressed with all the concepts you pulled together. I just left individual comments kind of throughout, giving you some little tips and advice, and so just go look at those as you're studying. Otherwise, great job, everyone.